Louie. How are you today?
I'm doing okay. How are you?
I'm doing pretty good. My name is Morgan. I'm an occupational therapy student. I'm going to be working with you today. Is that all right?
Yeah, that's okay.
Okay. Can you tell me your full name?
My name is Louie Lee. I'm 62 years old. I'm born January 2nd, 1962.
Okay, perfect. All right. Can you tell me a little bit why you're here today since we haven't really seen each other before?
Yeah, so a while back I broke my wrist. And it wasn't that bad, but now it's gone really bad and it's hurting a lot. I can't do a lot of stuff that I want to do anymore.
Okay. You got some pain and some swelling going on?
Yeah, it's really limiting what I can do.
Okay. Is it limiting anything specific that you'd like to get back to doing?
Well, I'm a homemaker, caretaker of my family, and so I do a lot of cooking. And so when I cut, it really hurts. So I can't do that.
Okay.
And I like to dress up all nice, with my hair, but it just hurts when I do that.
Yeah. Is it hurting really bad today? What's your pain today?
I mean, right now I haven't done that much, so it's kind of, I'd say it's about 5 out of 10.
Okay. Okay. Just one little thing that I'm going to do before we get started with the session for today. I read in your chart that you still have all of the feeling within your hand, on the back of your hand, or on the front of your hand, the back of your hand. Everything's feeling okay? Okay. I'm going to do a little test just to make sure that it's still intact since I haven't seen you before, okay? Okay, so it's just called a sharpen and dull test. So what I'm going to do is I'm going to have, I'm going to put one side of the pencil on your hand, the sharp side, and then the dull side, and I want you to tell me which side I'm touching. Okay, so can you lay your hands flat for me like this? Okay, and I'm just going to have you keep your eyes open right now, and then just tell me if you can feel each side. Can you feel that?
Yes.
Okay, so if I touch you like this, you would say?
Sharp.
Okay, and then this side?
Dull.
Okay. This one?
Sharp.
Okay.
Dull.
Okay. So now what I want you to do is I want you to close your eyes, and I want you to do the same thing. I want you to tell me which side of the pencil is touching you, okay?
Apart. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
All right, you can open your eyes now. Okay, now I'm going to do it on the back of your hand just to make sure that's doing okay. Just a couple times, okay? All right, I'm going to close your eyes again.
Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp.
All right, you can open your eyes. Good job. That was really, really good. All your sensation is intact. You did perfect on that. So what that means is we're going to go ahead and go into a ultrasound today, okay? So since all of your sensation is there, I think it's going to be fine to go do that. So basically it's just going to give you, it's going to loosen up those blood vessels and give you a little bit more blood flow so you can have a little bit more range of motion in your arms. And hopefully what it's going to do is increase or decrease that healing time, and then also decrease the pain that you're feeling within your wrist joint.
Okay.
Okay, does that sound okay?
That sounds good.
All right, we'll head that way.
Okay.
All right, Louie, so this is going to be our ultrasound machine, okay?
Okay.
And before we start doing this, I just want to ask a couple questions. Have you had cancer before?
No.
Okay. Do you have any night chills, night sweats, fever, anything like that?
No.
Okay. Do you have a pacemaker?
I do not.
Okay, perfect. So, kind of like I mentioned before, when we do the ultrasound machine, I'm going to put some gel on the area that you're having pain. So this gel right here is going to go on your wrist, And then with the head of this little machine, I'm gonna rub it on your wrist, and what it's basically gonna do is it's gonna go in and create a lot of blood flow, okay? So it's gonna loosen up those muscles, loosen up those joints. It's gonna get pretty deep within the skin, okay? And so what that's gonna do is allow you to have a lot more movement within the wrist, and it's gonna help decrease a lot of that pain that you're feeling within the wrist and the hand, okay? And hopefully with this, it's also gonna decrease the time that it's gonna take for that to heal.
Okay.
All right, so what I'm gonna do is I'm gonna clean the head before we get started. Alright, so I'm just gonna wipe the top of this off. Have you rest your hand, and we're gonna rest it this way. What part of your wrist are you having the most pain in?
Well, I would say like this part,
Okay.
moving like that, and when I have to cut stuff, it hurts when I move it like this. So yeah, I would say like this part.
Okay, so what I think I'm gonna do is I'm gonna have you lay your hand just like that, okay? And then we're gonna put the gel on this area, and hopefully what that does is loosen it up through the joints and through the muscles, okay?
Okay.
Alright. Now when I start this machine, I don't want you to feel any type of burning sensation or discomfort, okay? It should just feel nice and warm. Okay, we're gonna do this for about 7 minutes. Is that feeling okay? Too hot?
Nope.
Okay,
Feeling good.
okay,
Very soothing.
good. That's what it's meant for. Now that our 7 minutes is up, how does that feel? Feel good?
Feels good. Feel refreshed.
Perfect. Alrighty. So we're just gonna wipe this off, and then I'm gonna clean it again. You could just rest there for a second. Alrighty. Okay. I'm gonna lift your hand up just a little bit, and then you can place it back down on there. I'm gonna wipe all that gel off for you. Alright, does that feel okay? Your wrists feel good? Have any discomfort or anything?
No, I feel like I got more range of motion.
Perfect. Alrighty. So, Louie, how's that wrist feeling after the ultrasound?
Oh, it's feeling a lot better.
Good.
I want to cook something now. It's feeling good.
Love that. Okay, so when you have a lot of your pain, is it typically in the morning or at night?
That's a good question. I would probably say towards the night, because it's like after I've done everything, so it's like really hurting with all that stuff happening.
Mm-hmm. Okay, so since you have a lot of pain and a lot of swelling within that joint, and you said you want to get back to cooking and you want to get back to cleaning, our major goals for you and your wrist are going to be to strengthen it and increase that range of motion and movement within your wrist. I want you to get back to doing all the things that you were doing before, okay? So I'm gonna order this for you, okay? Your doctor and me are gonna order this. I fabricated it for you, okay? But I only want you to wear this at night, okay? So during the day, I want you to keep doing everything that you can do, but at night, we're gonna put this on, to help kind of decrease that pain and swelling that you get throughout the day. And I know that the pain is what wakes you up at night sometimes, and so I want to see if this will help throughout the night, okay? So, I prefabricated this for you. It's gonna match your wrist and it's gonna fit to you, okay? So I'm gonna show you how to put this on, and then I want you to demonstrate back to me how you're gonna wear it, okay? So basically, you're just gonna put your thumb through the hole, lay your wrist on it, and what this is gonna do is it's gonna put your wrist in a neutral position. It's called a cock up splint, okay? So it's basically gonna cock your wrist up and allow it to rest in a neutral position, okay? So what we wanna do is we wanna strap on the straps, and we wanna make sure that they're not too tight, that you can still slip a finger underneath the splint, okay? So, what I want you to do is I want to see you put this on really fast.
Okay.
Yes, perfect. So, when you wear this for the first time or for the first couple times, I want you to wear it a couple hours before you go to bed, so you can see if there's any redness or irritation on that skin. We don't want any skin breakdown around the thumb, around the wrist, any areas that can be more damaged than others. I really want you to be aware of any redness and irritation, okay, within that wrist, okay? Do you have any questions for me about the splint?
Like, am I supposed to clean this thing?
Yes, so when you clean it, I want you to clean it with something sterile or an alcohol wipe, okay? We want to try and keep this as clean as possible and moisture free. We don't want hardly any moisture within there. You want to keep it as dry as you can, okay? So do you have anything at home that you could use to clean it?
I think that's my Clorox wipes.
Okay, that would be fine. That should work good. Do you have any specific place in your house that would be a good spot to store that?
Kind of like a nightstand.
Okay,
Like a drawer.
that would work great. Just anywhere off of the floor, off of, if you have dogs, anywhere out of their reach. We don't want anything destroying it or grabbing it, okay? All right, does that sound okay? Does it feel okay, look okay?
Looks good to me.
Alrighty. Well, I'm gonna send you off with that. If you notice any irritation, if it starts getting uncomfortable in any way, please let us know, give us a call, and then we'll try and get that fixed, okay?
Okay.
Alrighty.